Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Many things impact our overall health and well-being, but one very important area that is often overlooked is sleep. Did you know that losing even just 1 to 2 hours of sleep per night for several nights can impact your ability to function? Sleep can also impact appetite, mood, and much more. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown. Stay with us. We'll be right back. Welcome back. Today we are going to talk about the importance of sleep and sleep medicine. Joining us this morning is Dr. Diana Corzine with the Montana VA Sleep Medicine Center. Dr. Corzine is board certified in sleep medicine. Thanks for joining us today.
Absolutely, my pleasure.
So since we're talking about sleep, can we just start by talking about why sleep is so important to us?
Yeah, so healthy sleep is incredibly important, not only to feel good, but to have good health. Not having good sleep can lead to a number of different problems. Problems with high blood pressure, heart disease, memory problems, cognitive problems, depression, PTSD, which is something that we see in the VA quite a bit, as well as excessive daytime sleepiness or even drowsy driving. And in fact, there's evidence that increased motor vehicle accidents happen when we don't have good sleep, as well as there's recent studies that show that all-cause mortality, including cancers, some cancers have increased incidence in patients with not getting enough good sleep.
Oh, wow. Okay.
Yeah.
So how many people would you say actually have sleep disorders?
Oh, quite a bit. Sleep medicine is a relatively new sleep, a new specialty. It probably came to be more popular in the 90s and the 2000s, but probably over 80 different sleep disorders, and as well as 40 million Americans are estimated to be suffering from a sleep disorder.
Okay. And are there certain factors that can contribute to somebody's risk for getting a sleep disorder? Yeah,
absolutely. So different medical problems can add to sleep disorders, as well as psychiatric problems, environmental factors. And age is a big factor for sleep disorders, in that it's estimated that 50% of patients over the age of 65 have a sleep disorder. Obesity is also a risk factor for sleep disorders, particularly like obstructive sleep apnea, and it's estimated that people over the age of 50, 20 to 30% of men and 10 to 15% of females have obstructive sleep apnea. Other things like big life stressors certainly can add to insomnia, which can be acute or chronic, and such as a change in job, a death of a loved one, changes in work, but then also, as mentioned, depression, stress, or chronic pain can add to sleep disorders. There are also certain genetic factors that can lead to sleep disorders. In particular, one that people may or may not be aware of are things like narcolepsy, and also recent data that something called delayed sleep phase disorder may have a genetic component as well.
If I'm somebody who is having trouble sleeping, how do I know whether it's just that or if I actually have a sleep disorder?
I think that's a great question. And what I would say is there's two questions you should ask yourself. Number one, when you wake up in the morning, do you feel like your sleep was restorative and refreshing? And then the second question is, do you feel that you're rested throughout the day? Do you feel sleepy? And this is without any caffeine. If the answer to either of those questions is no, then you may have a sleep disorder. And while many of us occasionally experience problems sleeping for a variety of reasons, it is when these issues kind of occur on a regular basis and interfere with our daily function that there may be a sleep disorder. There's many, many different types of sleep disorders, as I mentioned, probably 80 different kinds of sleep disorders, and it can be from difficult difficult falling asleep or maintaining sleep or feeling extremely tired during the day. But they can also be a symptom of another medical or mental health problem. So it's really important to ask for help if you're suffering from problems sleeping or not feeling refreshed.
Okay. So you mentioned being sleepy during the day, not feeling refreshed. Are there other things I should be looking out for if I think I might have a sleep disorder?
Yeah, so difficulty falling asleep or staying asleep, having excessive daytime sleepiness or drowsy driving, having a strong urge to nap during the day or unintentional napping, irritability, anxiety, insomnia, lack of concentration, snoring, or if a bed partner notices that you stop breathing when you're sleeping at night.
So you mentioned seeking help. How would I go about doing that?
I think the first thing is perfect just to talk to your primary care provider. They should ask you more questions about your sleep, and they are going to look for other medical conditions that may be affecting your sleep, so they may do a physical exam as well. They'll want to hear about your symptoms and your medical history or medications you might be taking to help yourself with sleep, and they also may, after doing that assessment, refer you to a sleep medicine physician for a sort of further in-depth review of that.
Okay, and what kind of tests might get ordered for me?
So your primary care provider will want to make sure that your body is healthy, and so if you're feeling sleepy, they might order thyroid tests or other blood work, including a complete blood count. Make sure you don't have anemia. Check your electrolytes and your liver and kidney function. A sleep doctor will order most likely sleep testing. They're going to want to have some data. It's a little bit like if you give a carpenter a hammer, everything looks like a nail. But a sleep doctor will want to order some sleep testing. There's a number of different kinds of sleep testing. The most common tests one is called a home sleep apnea test, and it's to assess for sleep apnea. And another common test is something that we call an in-lab testing called polysomnography. The difference between a home test and an in-lab is that the home test, while it looks at oxygen, pulse, body position, and your breathing, the home test doesn't have leads that look at what stage of sleep you're in or what electrical activity in your brain you're in, whereas the in-lab polysomnogram will have that. The home test can be more convenient for patients at home, but there are certain patients that aren't good candidates for home testing, and so the sleep doctor will know which test is best for you.
Okay, perfect.
Yeah.
All right, thanks. We actually are needing to stop for a break here, but coming up next, just how much sleep do we need to maintain good health? We'll find out that and much more right after this. Stay with us. We'll be back after these messages. Welcome back. Dr. Diana Corzine with the VA Medical Center Sleep Clinic to talk with us more about sleep health. Thanks for sticking around.
Absolutely, my
So
pleasure.
could you tell us a little bit more about, you said there were over 80 sleep disorders. Can you talk about some of those, maybe some of the more common ones?
Sure, yeah, and there's probably about 6 different common types that we usually talk about. One of them, the most common, is sleep apnea, insomnia, circadian rhythm disorders, something called parasomnia, which is like a sleep movement disorder, a restless leg syndrome, and narcolepsy. I think sleep apnea is common and worth talking about a little bit more. And in particular, it's where a person stops breathing during their sleep. And in obstructive sleep apnea, that's where the airway kind of collapses down. But when that happens, the brain sends adrenaline to tell you to wake up and breathe. And those adrenaline surges are what really disrupts the sleep and increases the stress during sleep, when sleep is supposed to be a time of rest and rejuvenation. Your oxygen can also drop when you have that airway collapse. And again, that increases the risk for a lot of people for poor sleep, not feeling good, and then things like stroke and heart attack. Not treating sleep apnea increases your risk of hypertension, heart disease, atrial fibrillation, congestive heart failure, and coronary disease. So it's very, very important to treat sleep apnea. The treatment for sleep apnea is commonly something called CPAP, or continuous positive airway pressure. And so that's an important one to know about. Insomnia is also very important. And that's the inability to fall asleep or maintain sleep. And it usually, the definition occurs that it's more that happens happening more than a month and affecting your function. Because all of us can go through times when we don't sleep very well. There are certain sleep disorders that can add to insomnia, like obstructive sleep apnea and restless leg symptoms, but other factors such as depression and anxiety, as well as an irregular sleep schedule, caffeine, tobacco, and alcohol add to insomnia. Circadian rhythm disorders, that's things like jet lag or patients that have shift work and they vary their sleep and wake time. That's very disruptive to sleep and can be difficult to treat as well. Movement disorders in sleep, like parasomnia, such as walking, talking, or nightmares, or acting out your dreams, are another kind of sleep disorder. Restless leg syndrome is a symptom where patients have to move a lot and move their legs prior to falling asleep, and it makes insomnia worse as well. And then narcolepsy is where there's sleep-wake instability. So patients who want to be awake, but suddenly sleep intrudes and they fall asleep without control, or even when they're sleeping, awake intrudes in their sleep. So that's a teeny tiny tip of the iceberg when it's talking about sleep disorders, but those are kind of the most common.
And you mentioned the CPAP for treating sleep apnea. What are some of the other treatments that folks can get for sleep disorders?
So great question. Melatonin can help with circadian rhythm disturbance, but it's not something that patients often think it's an over-the-counter. You can just sort of take it in a particular as needed, but it should be taken in a particular way to help those sleep disorders. Some medications can help with sleep, but really important also is something called cognitive behavior therapy for insomnia, and that helps change how we think about sleep and improve our sleep schedule. So that's very, very important. Lifestyle changes are key to improving sleep. Again, having a regular sleep schedule, getting enough sleep, avoiding tobacco, alcohol, and caffeine, and then avoiding screens prior to bedtime. The blue light in screens can really affect our sleep and delay our own internal melatonin.
Okay. So we've talked about sleep disorders and their treatments. Is that what you do at the VA, or can you talk a little bit about what you do and what is a sleep clinic?
Great question. So yeah, I am the chief of the sleep medicine service for Montana VA, so that's over the whole state, and we have a 4-bed sleep lab. So we do in-lab studies. We also do home testing. We do something called nocturnal oximetry, checking oxygen as well, and we also have CPAP clinics, so respiratory therapists who help patients with the equipment and set up the CPAP. We do a lot of telehealth visits and consultations, both in person but then also telehealth, because we may see patients in Plentywood, and we're here in Helena. And we treat all of those different disorders, and in particular sleep apnea, insomnia, PTSD related problems with sleep, nightmares, restless leg, things like that.
So you are at the VA, so obviously you work with veterans. Is that a population that particularly suffers from sleep disorders?
Yeah, there's an estimate that veterans in general, there was a recent study that suggested that almost 25 to 35% more likely for veterans to have a sleep disorder. And this is particularly for patients who've had combat experience, but even without combat experience, veterans are 3 to 4 times more likely to have sleep apnea. Veterans do tend to have more medical issues, and that can add to sleep apnea as well as compared to the general population. And then of course there's PTSD and insomnia that adds to it. And a recent analysis of a veteran sleep diagnosis from 2010 showed a 6-fold increase in sleep disorders in veterans, the most common being sleep apnea and insomnia.
Okay, so we are just about out of time, but do you have any tips on, number one, how much sleep do we actually need for good health, and how can we get that good sleep?
That's a great question. So how much sleep you need really depends on your age. So in infants, you need about 12 to 16 hours. Children, 1 to 2 years, 11 to 14 hours. Children aged 3 to 5 years, about 10 to 13 hours. And then I'll jump to teens. Teens need about 8 to 10 hours a day. That's an important topic that we can talk about at another time. Okay. But adults usually need about 7 to 8 hours of sleep. And getting that regular sleep schedule is a really good idea, as well as avoiding tobacco, alcohol, and caffeine.
Great. And you mentioned the screens too. Stay off those
Staying off the screens also really important, particularly for those teen patients, particularly prior to bedtime.
Okay, great. Thank you so much for being here, Dr.
My pleasure.
A lot of great information. We appreciate it. Up next, one person's personal experience with trying to improve her sleep and overall health. We'll hear her story right after this. Stay with us. Thanks for staying with us. We are joined now by Virginia Toyson, who is here to talk to us about her personal sleep health experience. Thanks so much for joining us this morning.
Well, thank you for asking me.
Sure. So I understand you use a continuous positive airway pressure machine, or a CPAP. Yeah. Could you start by talking about what your CPAP does for you?
Well, it certainly makes me wake up a lot more alert, and I feel more rested. More energy. It helps me breathe. It keeps me from snoring during the night. That's one thing. I think it's a really good unit.
Good.
I like it. I'm satisfied. I would recommend to anybody that needed one.
Okay. And why did you decide to get one?
I was told years ago that what they told me was, you stop breathing when you're asleep. You stop for 30 seconds, or you're not breathing for this, and then you snore and then you start. And so I went to my doctor, and he told me that I had sleep deprivation and I needed to have a test, which eventually I finally did, and I was proven that I had sleep apnea very bad.
Okay.
But I have only had the machine for 3 years, so I've had it for a long time.
Okay, and it has improved the quality of your sleep?
Oh gosh, yes. Oh yes, much, much better.
And you said that you wake up more alert, but what about when you're sleeping? Are you ever aware of it while you're asleep?
If I have to go to the bathroom or whatever, then you have to take it off and all
Sure.
that. But if the mask gets a little bit twisted, and sometimes that happens when you're moving, or the straps, and you just have to straighten it out, and it's fine. The machine itself is very quiet.
Okay.
I was
Good.
really surprised, because
Good.
I remembered those old-fashioned ones that were big and noisy, and this is wonderful.
So you said that you've been using it for 3 years?
Yes.
How often do you use it then?
Every night.
Okay.
Every night.
And I know that you brought it with you today,
Yes.
so can you kind of describe what the different parts are?
Yes, I sure can. This is the part that hooks right in here. This it just hooks there, and this goes in here. And I always cover it when I'm not using it. And this is the tank for the water, and you have to use distilled water. You can't just use regular water. You always use distilled.
Okay.
And this turns it off and on.
Okay.
And this will tell you, well, it's not, but and it'll tell you when it needs a clean filter, and that
great.
Yeah.
So what does the water do?
It's heated. And so it just makes a moisture, so you don't get that dry nose so much in the dry mouth, which I don't usually have.
Okay, great.
It's very good.
And so you mentioned that sometimes the cords can get caught. Are there other problems that you've run into with using the CPAP?
Boy, I don't really know. I don't really have a lot of problem with it.
Okay, good.
I've gotten pretty used to it. It was a little bit difficult when I first got it, because they said you have to use it for 4 hours, otherwise they won't pay for it or something. So I would put it on for 4 hours and take it off. But after a few nights, I just left it on, and I've gotten used to it. It's fine.
So what was it in the beginning that bothered you about it, or what did you have to get used to?
I think it was just the idea of having something on your face and the
Sure.
straps around your head.
Okay.
I think it was just, but you get used to that too. And the technician up at St. Peter's, where I got it, when I first got it, I went in there and she gave me a little lesson on it, well, quite a big lesson on it, and showed me all about it and put it on, and we did it, and she was very good about explaining how to use it. And if I have a problem, I can always talk to them.
Good.
And I go there to get my filters. And
So what were some of the tips she gave you about using the CPAP machine to make sure you were using it correctly?
just to make sure that it was on right, you know, to make sure that it was sealed. If it's not sealed, then it'll make that noise. So, and I did that, and to use the distilled water, and that's pretty much all. It has a lot of information with it about cleaning it, and I just clean it. You don't clean it with alcohol or things, a disinfectant like that. You just clean it with, I use Dawn antibacterial soap and just clean it in the sink, and it works really good that way. So.
You don't want to clean it with anything that you'd be breathing in?
No,
right.
No, or anything that would destroy the plastic.
Okay, gotcha.
You know, like alcohol or any of those detergents that are harsh, anything harsh like that.
So some folks have to go into a clinic to do a sleep test. Is that what you had to do?
Yes, I did.
Can you talk a little bit about how that was?
It was great. I went into St. Peter's, and I had my sleep test. I slept all night, and I thought I did anyway, and pretty soon the technician comes in and puts this mask on my face. And I says, well, I guess I must have sleep apnea. And she said, yep, you sure do.
So she knew
and
it
I've
while you
had
were
it
there.
ever since. Well, they monitor everything you do. They can see everything you do and everything you say. They can hear, and it was a really good test. I thought they did very well.
Did they have to hook you up to things, or how do they monitor?
Oh yeah, yes, they hooked me up to a machine there, and what they hooked me up there was the fell face mask, and I didn't really like that. That was kind of claustrophobic for me. So when I picked my own, I got just the little nasal one, which
Yeah,
works
that one is
fine.
small.
Works
Great.
fine.
Good. So any tips or advice you would give to anybody who's watching right now who has been told they might need a CPAP machine and has not gone out and gotten one?
Is have the doctor, if the doctor suggests it, have the test and get one, because you won't regret it.
Perfect. Virginia, thank you so much for being with us today.
You're welcome.
We're out of time, and I'd like to thank Dr. Corzine again for her time and experience this morning, and thank you for tuning in today. I hope you found our show to be helpful. Be sure to come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.